Welcome to the Power of One. Today, we are going to speak about dental health, which is extremely important. Joining me today is Dr. Ozzie Smith. Welcome to the show.
Thanks for having me.
You're welcome. Let's dive right in. You are not one who's pretty much loved. I cannot stand going to the dentist. It just gives me anxiety. Tell me what you do with a patient like me who is just anxious about going to the dentist.
Well, I usually try to appeal to, their human side. Say, hey, look, give me an opportunity to hurt you before you decide that I'm going to hurt you, in your head. I give them uh, the analogy of that, hey, if you have some bad food, doesn't mean you're going to stop eating that food. Maybe you don't eat at that restaurant anymore, and that everyone does things differently. And you have to go someplace where you feel comfortable. So I try to get to know the patient before I do even get anything, before I touch them. We have a conversation first and try to establish a little bit of a rapport, make them feel as comfortable as possible because, dentistry has changed. If you have the perception of dentistry from when you were a child, technology has changed, make things a lot more easier. We can deliver treatment with a lot more efficiently and without as much pain as it used to be. So try to have that conversation and talk them off the ledge if I can.
And that's the part I can't stand. That gel that you're gonna put in my mouth before you do the needle.
Mhm.
And I mean, the medical field has changed and advanced so much, Dr. Ozzie. Why is it that with the dentist you still feel a little pain?
Well, that again goes back to how it's done. Like, I personally feel like there's a sections of the mouth where I can give anesthesia and the patient won't even feel it. Like, there's some spots where it's just going to be what it's going to be. But believe it or not, some technology that exists where it can deliver anesthesia without much pain that I hear at all. But at the end of the day, a needle is still a needle. They had tried to pioneer this sniff anesthesia, and it was kind of out on the market, but I don't think it worked that well. But that's part of it. And before I do it, I always say, hey, got to do everyone's favorite part. We got to get you numb. We got to put that tooth to sleep, and people are usually like, yeah, yeah, I know it's coming. And we try to make it as painless as possible.
So tell the viewers how important it is to have that dental checkup, like they go and get their full physical. How often should someone have a dental checkup and how often should they see their dentist?
Well, that's a little bit of a multi-layered answer. So most people have been kind of trained to believe that you should go to see your dentist twice a year. I would say that probably 80% of the people that come in twice a year, that's not really adequate. That's what dental insurance will pay for, and that's what they want to pay for. But most people really need to come in every 3 to 4 months, depending on how well they're doing keeping their oral hygiene at home, and if they're flossing or not, and if they have any previous history of gum disease. If you have gum disease, you absolutely need to be in a minimum 4 times a year, especially if your oral hygiene is not the best. So we need to try to get you in as often as possible to try to maintain it. Unfortunately, there is no cure for gum disease. Our best thing to do is to catch it early and try to keep it from getting worse. So, and with that, gum disease is not always painful. So, like literally, you can have bacteria eating away at your bone, making your teeth weak and eventually maybe even falling out. And it's not going to hurt you. Like most other health conditions, there's something wrong, like it's going to hurt and you'll know to go in. That's not always the case with gum disease. So, coming in very often so we can prevent it is the best line of defense.
Now, I did notice that, like with the dental insurance, it's not really like your medical
Mhm.
insurance, and a lot of work that needs to be done costs a lot of money. So again, that dental insurance is not like the medical insurance that you have. And I'm sure that you see that prevents people from getting a lot of work done because they can't pay that out of pocket expense.
Oh, absolutely. Dental insurance has not really changed that much over the past 50, 60 years. Like most insurance plans will give you an annual maximum somewhere between 1,500, maybe 2,500 if you're lucky. But even that is not adequate because guess what? It was 1,500 to 2,500 50, 60 years ago. We all know
Mm.
how much gas has gone up in 50, 60 years, or eggs just recently, milk. All this stuff has gone up exponentially, but the insurance companies have maintained that same level of coverage for the past 50, 60 years. And that's just not adequate for most of the patients. Like if you actually need some dental work done, you'll run through that very quickly. Like if you have someone that is of great dental health, then the 1,500 to 25 is adequate for them. But if you actually need work, it's never going to work. And dental insurance is not going to be your friend. And it's a sad thing that this is the way it is, but most people won't complain about it because, as you mentioned earlier, nobody wants to go to the dentist. So why would they change it if they're not going to go anyway? So it's kind of a double-edged problem there. So
It is bad. I do know someone who has lost a tooth. My cousin, it was right before his wedding. And he goes to a dentist, and the dentist tells him, we can do the permanent tooth, but if you want something temporary, we can do something called a flipper. But the flipper is $700, and you got to pay the flipper out of pocket. The insurance company is not going to pay for the temporary tooth because they're going to pay for the permanent tooth. And so you wonder why you see people walking around with missing teeth. They cannot afford to get their grill fixed. Like, what other options are there? And does dentists offer other options for their patients?
I would say most do, but again, like dental insurance, it's a necessary evil. But you have someone sitting across the desk dictating what you get done to your mouth while you have the dentist there looking in your mouth, telling you what you need, but you can't even access it via your benefits because if you operate based off what the insurance will do, you'll never get anything done. So there are outside financing companies that allow people lower cost options to be able to access some of the treatments because sometimes when someone needs like a full mouth like reconstruction, you're looking at maybe $50,000, $60,000 worth of cost. Like there's no insurance that's going to pay for that. And the only way you're going to access that is with, unless you have the cash, which most people don't, via outside financing companies. And that allows people to get some of the more expensive things done, still at a manageable monthly cost.
I hear root canal is needed a lot. When I go to the dentist, it's like root canal, root canal, root canal. And I know you're a dentist and your loyalty is with all the other dentists. Why does it always seem that a root canal is needed on at least 1 to 3 of your teeth in your mouth?
Well, I hope that's not true because root canal, typically you'll need that if like a cavity has gotten really big or if you had some sort of trauma to the tooth, or sometimes a filling that's been there for a long time has kind of caused the nerve to internally become infected. And then so you'll need a root canal to kind of keep the tooth in the mouth. A root canal is more of a kind of a last resort to try to save the tooth. And there's nothing better than your own natural tooth. If we can save it, that's the best thing that we want to do. We can obviously replace it, but nothing like maintaining what you have naturally. But yeah, root canal really shouldn't be like a common thing. But if it gets to that point, then we get there as well.
Is it times where dentists will make recommendations based on the insurance so the insurance can pay to get done what you need to get done?
Well, I mean, I hope not. But the thing is, you never want to allow the insurance company to kind of dictate what you actually need. Like now, there's a difference between allowing them to kind of govern what happens in your mouth versus maximizing what they'll do, but still doing what the patient needs. I kind of like will trend towards the latter because, yeah, this is what you need. This is what insurance will pay for. This is what we can do to allow you to maximize what you have, but you're still going to have to come out of pocket this in order to kind of get everything that you need. So
Let's talk about major problems that someone can actually have in their mouths. Can you have cancer in, you know what I mean, is it of the tooth, or of the mouth, or of the gums? Are there major diseases that can affect the teeth?
oh, absolutely. Oral cancer is definitely a thing. You have a higher risk of oral cancer if it's smoking and drinking in conjunction with each other, but smoking for sure. Like it can cause you to have to lose like half of your jaw or half of your tongue if it gets so severe. And early detection again is the key, which is why you should, very minimally be going in to see your dentist at least every 6 months. But again, most people really need to come every 3 to 4 months in order to kind of keep everything adequately clean and healthy. And if you're at a higher risk, yeah, maybe you should come in more often. So you can definitely have cancer of the mouth.
I did see one time when I had to go to the dentist, and I went to not my regular dentist, but I went to another one. And so they put this thing in my mouth and they just told me to put my chin there. And it just said,
Mhm.
I was like, oh, my dentist does not have this, because my dentist did the normal, open your mouth and, you know
Mhm.
what I mean, with the big thing, and then the bringing the other thing around. So technology has truly changed as far as the dental um,
The
game is
X-rays,
concerned, I
yeah.
guess.
Oh, for sure. It's changed since even like since I graduated. I graduated dental school in 2005. And if I practiced exactly the way I was taught, like I'd be a dinosaur already. But I definitely invest heavily in technology because the technology is there to make us more efficient, be able to diagnose things better, be able to deliver the treatment more pain-free, more efficiently and more predictable as well. You get more predictable outcomes, better quality dentistry, and it just works. The old way still works fine, but sometimes there's a better, faster, more efficient way to do things.
I did notice that in my dentist's office, he spoke about this pain-free injection. Are you familiar with that?
Yep.
So tell me about that. Is there still that nasty gel that has to go in? But he said he does something on the computer and you don't even feel like the injection. So break that down for the viewers.
Yeah, there's an instrument called the wand, and it is a computerized anesthesia delivery system. And like, there's still a needle, and it's not 100%. Like some people will still, you're still going to feel it's a needle, but there's the way that it's delivered. It's supposed to deliver it with less pain. Like now, there are some things that you can do with your regular. Um, Syringe and needle yourself that can kind of minimize the pinch of the needle as well. Yes, and part of it is using the gel, but using it effectively. There's even prescription gel that you can use that kind of pre-numbs the gum tissue a little more, so that the pinch of the needle isn't felt so much. So.
And then you guys have different types of needles. Like when I'm getting stuff done in the front, I noticed that the dentist has like this little hook of a needle. So you have like a hook of a needle, and you have the regular needle that's straight. So you have different types of needles for different parts of the mouth.
Yes and no, but a lot of times that's dentist made too. Like we'll bend the needle to kind of angle it at different spots. So all of them are straight, but if you saw a hook, somebody probably put a little bend in there to kind of get at a spot a little bit differently. So,
Okay. All
yeah.
right. So I have another question. So those tools, I guess the not the drill, I don't know, you know the name of them and what they're called. Why is it that air comes out when you're actually, you know what I mean? I don't know what it's called, the drill or whatever, but that air is so irritating.
So those the hand pieces, the drills that everyone are accustomed to seeing. The way they operate is by air like passing through it to spin the turbines to allow the birds to rotate. Now, and it's not that old at all, but I mean not that new. There are electric handpieces now too that you don't get the air because it's electronically driven as opposed to air driven. But that's the reason that the air goes through the handpieces there, because it's literally a compressor that sends it through the unit. So then when you press the pedal, it'll send the air through the handpiece to spin the burrs.
Dr. Ozzie, please tell all the viewers how they can keep up on their dental hygiene. How many times should they be brushing a day? Should they do after a meal?
You want to brush at least twice a day. You're going to get your greatest therapeutic health benefit if you brush before you go to bed versus when you wake up in the morning. They say you brush in the morning so you can keep your friends. You brush at night so you can keep your teeth. Okay. And flossing is by far the most important thing to do. And then flossing properly is even more important than that. Most people that are flossing are not really doing it the right way. Those little picks with a little piece of string in it, those really aren't that good. And you really want to use like regular floss so you can get down into the sulcus in between the teeth and the gums to clean out all the debris, because that's the area that your toothbrush will not reach. And that's where all the plaque begins to build up first. A good way to think about it is if you were to go to the bathroom and just wipe the outside of your body as opposed to in between the folds, you're not really cleaning much of anything. So the toothbrush gets the outside, the floss gets in between everything. So if you keep that in mind, you will probably never, ever not floss again. Another thing you could do too is like if you floss your teeth, if you actually like ball the floss up after you flossed your teeth and smell what it smelled like, you're like, okay, this is everything that my toothbrush was leaving behind. I'm not going to ever not floss again. So flossing, 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 and brushing at least twice a day.
Tell me about mouthwash. Is that good? My husband just recently saw something that said when you brush your teeth and then you use that mouthwash right after, you're basically washing away all those great ingredients that was in the toothpaste. So talk about mouthwash.
Yeah, I'm right there with you. Like the toothpaste has, fluoride and things there to help strengthen your teeth. So even after I brush my own teeth, I'll spit out the toothpaste and then I'm not rinsing my mouth out with anything, no water, nothing. I'm not putting anything in my mouth for at least 5 minutes to allow the toothpaste to kind of do its job. But yeah, if you rinse with mouthwash after, yeah, you're washing stuff away. So if you're going to use mouthwash at all, and you can do a pre-rinse, like if you wanted to, like, just have that filling in your mouth. But it's really best after you brush your teeth just to spit out and go about your day.
Okay, so it's you said a pre-wash. So would you do the mouthwash before you actually brush?
Yeah, I mean, if you're going to do it at all, like I don't really do mouthwash, to be honest, like it's kind of extra credit. If you're doing a great job of flossing and brushing, like you really don't need it, really. So.
Okay. And see, I always thought that mouthwash was good. And I see on there it helps with gingivitis, it helps with gum disease. So does mouthwash actually serve a benefit?
So there is like some prescription mouthwash that we'll prescribe sometimes for like patients with gum disease. There's like a benefit there for sure, but like for the most part, your over the counter mouthwash. Again, like if you're brushing and flossing adequately, that's all you really need. Like you got to break up that plaque and then you got to brush and clean it away. The mouthwash is extra. It's not really doing like a ton, adding a ton to the oral hygiene regimen for.
Wow. So do you recommend brushing after each meal?
Most people aren't going to be able to do that. So it doesn't break my heart if you don't brush after every meal because, we're working. How many times are you going to run to the bathroom to do that, especially if you're snacking and stuff in between. But again, if you brush, the most important time to brush is at night before you go to bed. Get the day off of your mouth, get everything out, have a nice clean mouth when you go to bed. And if you do that, you'll be doing more than most and then you'll be in a good situation.
Dr. Ozzie, what are some of the foods or snacks that are just horrible on the teeth?
Well, obviously sweets, candy, chips, cookies, any starches, carbohydrates can actually turn into sugars as well. So all this stuff is not great for your teeth. But
My
I'm
favorite, my
I'm
favorite snack. And sometimes after I brush my teeth, my husband's he look, it's him. He's probably laying in the bed, he's eating that chip, and he makes it sound like it's on a commercial. So I just
Mhm.
brushed my teeth, so I'm sitting there eating the chip with him. So chips are actually bad for your teeth also.
Yeah, chips can, anything I say with starches in it, they can turn to sugars on the teeth. So like you can definitely get cavities from eating too many chips too. So
Well, you've just put a damper on my mood. So I guess I have to have good willpower. And I just automatically thought it was like candy
yeah.
and raisins are bad too, aren't they?
Not really. Like, raisins, with dried grapes, right? But anything that has sugars in it can be bad. Like at the end of the day, making sure that, you're brushing at night. At nighttime, that's the most important time. Because if you're going to get some cavities beginning to form, it'll happen at night when your body's defenses are down, and especially if you gave it something to kind of feed off of, like some sugary liquids, starchy foods, some candy. Oh, so they're gonna have a field day, and you will have cavities.
Well, I will try not to snack after I brush. I will be good and let the toothpaste do what it's supposed to do. So before we end, what message would you have for all of the viewers to have good dental health?
Floss, floss, floss. Brush at least twice a day. Most importantly, at night before you go to bed. Drink water. If you chew gum, switch to sugar-free gum. Sugar-free gum can actually help to prevent cavities by stimulating saliva flow. And see and visit your dentist at least twice a year. If you have a history of gum disease, you need to be in there every 3 to 4 months. Early prevention is the key.
Thank you so much, Dr. Ozzie, for joining us today.
No problem. Thanks for having me.
Thank you so much for joining us for this very important episode on dental health. Please make sure that you are keeping all of your dental appointments and make sure you visit your dentist at least 3 to 4 times a year. Peace and blessings.